Good evening. My name is Chris Martin. I'm your host for Feet Forward. This is the fifth episode of Feet Forward this year in 2008. It's sponsored by the Illinois Podiatric Medical Association. And tonight we're going to be talking about seniors and foot health. And with me today is Dr. David Finkelstein, who is a podiatric physician from Oak Lawn. Dr. Finkelstein has been a podiatrist for about 17 years in the Oak Lawn area, and he currently works with a diverse population, but wouldn't you say that most of your patients are seniors and have similar foot problems that a lot of other seniors have these days?
For the most part, at least 80% of my patients are in that category.
Great, great. And you also serve 3 or 4 local hospitals from Holy Cross, Mercy, and Sacred Heart, right?
The west side and the south side, yes.
Great, great, great. Today we're gonna divide this show into two segments. First of all, I want to talk about some of the diseases that are very common among seniors and some of the foot problems that result from there. Okay. And then we'll drill down and talk to a little bit more about the specific disorders that you see.
Sure.
So we want to talk about some of the common ones like diabetes, arthritis, and other circulatory problems like peripheral arterial disease, for instance.
Okay.
So first, why don't you talk about diabetes, because that's the most common problem that plagues a lot of Americans, not just seniors, but it really comes home to roost with seniors, doesn't it?
Diabetes is very common in the elderly. We used to talk about type 1, type 2. It really isn't called that anymore. We talk about insulin-dependent, non-insulin-dependent diabetes, and that can occur at any age. And
from a foot health point of view, when a patient presents in your office, what kinds of problems do you see? Oftentimes the podiatrist is the first one to detect diabetes in a patient, isn't that true?
Well, diabetes affects 2 main systems in the feet. It affects the arteries, obviously, through atherosclerosis, and it affects neuropathy, the nerves. So it's a double problem for them, primarily. When it comes to neuropathy, they lose their sensation in their feet, leads to calluses that are not painful initially, but then can lead to ulcerations. And vascular disease, obviously, a big important problem that also leads to ulcerations.
And talk a little bit about the nerve problem, because as I understand it, one of the problems that the seniors face is they can't feel any pain in their feet, so they don't know whether to check or to call a podiatrist for a checkup, and that it creates a circular problem almost for them, right?
Usually it's a problem that they really don't detect because it's such a slow process, especially when your blood sugar levels start to rise. As those levels start to rise, the nerves start to die. Basically, the myelin, the covering of the nerves, like the insulation, like in a wire, becomes eroded. And that neuropathy leads to a whole cascade of problems in diabetics.
And from your perspective, what kinds of treatments are you offering your patients, depending on how far along in the stages of diabetes they are?
Well, the most important thing is preventative care. Diabetics should see a podiatrist at least every 3 to 4 months for an examination. They should examine their feet daily themselves. If they do see something, or have a family member examine them. Most diabetics have poor vision and can't reach their feet, so someone has to look at their feet on a daily basis and get examined and treated by a podiatrist every 3 to 4 months. 3 to 4 months should be adequate for most diabetics.
Great, great. And of course, if anybody has a question about whether they may have diabetes, we certainly encourage them to call the Illinois Podiatric Medical Association, get a referral from a local podiatrist. The IPMA folks are always happy to direct you to a podiatrist very close to you. Now, I also want to talk about arthritis, because that's a different kind of disorder. It's not vascular related. It has to do with cartilage, and it's more of an autoimmune disease, but it's still very common in seniors, and it can be as big a problem to treat as diabetes, isn't it?
Oh, absolutely. The foot has 26 bones. It has 33 joints, and it's a weight-bearing structure. So most weight-bearing structures do have arthritic problems. The most common, there's 2 most common types. Osteoarthritis is like the wear and tear type of arthritis, and rheumatoid arthritis. And both of those types are found in the foot and very common, seen every day in a podiatrist's office.
And what kinds of symptoms do you see in patients who might not have been diagnosed already with arthritis in the feet? Because I think most people assume that you're getting kind of arthritis or stiffness in your wrists or your joints, your knees, your hips. But what about the feet? Do you see that a lot?
Basically the same type of thing. You have tenderness, pain, swelling, and it occurs in areas of deformity. People that have bunions, it's like having a tire out of alignment. When you have a bunion or a hammer toe, joints that are out of alignment are prone to arthritis.
And how do you approach these kinds of patients? What kind of treatment do you have to offer? Because it's a hard disease to prevent, isn't it?
No, there's no doubt. Basically, you can start with over-the-counter anti-inflammatories, prescription anti-inflammatories.
Is that like Tylenol, ibuprofen, aspirin?
More or less, that's a good way to start. Then there's prescription anti-inflammatories that are prescribed by podiatrists and other medical physicians every day. As the problem gets worse, there's, obviously a rheumatologist would treat a more involved type of arthritis, but the thing that we want to treat is like early prevention, things with orthotics, physical therapy, injections of the foot if necessary in arthritic joints, which become very, very painful.
Mm-hmm. And what about cases that get more severe or acute? Are there surgical options that you can offer?
There are surgical
now?
options, of course. There's ankle fusions, there's ankle implants, there's implants for all types of joints in the foot. Primarily the big toe joint and the ankle are the most common implants put into the feet.
That seems a little severe. How do podiatrists perform that on such a small area? Most of the implants I'm familiar with are knees and hips, which are larger joints.
Well, the implants in feet have come a very long way since I've been in practice. When we started out doing implants, they were basically made out of silastic, which is like a plastic almost. Mm-hmm. And now the newest ones are titanium and all types of plastic polymers. And before we'd only do implants on people that are in their 6th or 7th decade of life, and now we're doing implants on people that are younger because these implants will last a much longer time now.
And how long does that surgery like that last, and how do the patients come out of it generally?
Well, it depends on which joint you're replacing, what type of implant you're putting in. The surgeries are well tolerated by most people. They go to physical therapy afterwards, and they could probably be back into their shoes in 6 or 8 weeks after the surgery.
Now, also, podiatrists are becoming more recognized for treating other kinds of problems, circulatory problems like peripheral arterial disease, or PAD as it's commonly referred to. And more research is now coming available that shows that patients that have PAD or circulatory problems in their lower legs also most likely have heart problems too. Absolutely. It's almost a marker for that. So sometimes you're able to actually detect a severe circulatory problem like heart disease or even a risk for stroke based on what you see from the foot. Tell me about some patients that you've treated about that.
Well, the foot being the furthest structure from the heart, that's usually the place where things go bad first. So if during an examination, if the doctor can't feel your pulses, those are things we look for, obviously. If we feel weak pulse, that's a thing to look at. Ulcerations that don't heal on the foot or are slow to heal are another marker of poor circulation. And those should be investigated further.
Okay, I think we have our first caller.
Okay.
Go ahead, you're on Feet Forward.
Okay, I want to ask you something. I got a foot rash. I wonder how can I treat it?
You said a foot rash?
Yeah.
Where on your foot is it?
On my left foot.
On the top or the bottom?
On the bottom.
On the bottom of your foot?
Yeah.
Does it itch? How long has it been there?
It's been there for a while. It's just sometimes.
Have you seen a doctor about it yet?
Uh-uh.
Have you tried any treatment of your own?
No.
Well, you can have a lot of different rashes. The most common one is a fungal infection of the skin. Obviously, there are over-the-counter antifungals that you can use. If that doesn't work for at least a month, after a month, you should probably go ahead and see a physician and get a proper diagnosis. But a fungal infection is probably the most common